Hello everyone, I am Dr. Rajesh. So today we are here to see how to palpate the spleen. Not very tough thing to do, but usually when I ask people, students in the exam, they usually commit some sort of mistakes. So I thought that I should make this video to make it very clear. So we have this subject who has splenomegaly. He is under investigation for the cause of splenomegaly. I just want to mention what are the common causes of splenomegaly in our country. One of the most common cause is malaria. Then at this age group, when we have a spleen palpable, you should always think about myelofibrotic disorders. You should think of leukemias. Young patients with splenomegaly, you should think of hemolytic anemias and all. So these are storage disorders, etc. So these are the common causes in India of splenomegaly. So let us directly jump to how we examine the spleen by palpation. So first of all, when the patient is lying in front of you, always try to make some rapport with the patient by instructing what you are going to do. For example, we just had winter months few months ago. So if had it been a early winter morning, I would have rubbed my palm to make it a little bit warm before I touch the patient's abdomen. So in that sense, you should always educate the patient first what you are going to do, and then you should always proceed with the procedure. काका, आपका थोड़ा पेट तपासना है, आप इस घुटने को थोड़ा मोड़ दीजिए. So I am asking the patient to flex his knees so that the abdominal muscles become relaxed. Try to turn the face of the patient on the opposite side so that when you tell him to breathe in and breathe out deeply, they do not breathe on your face. What happens on breathing? When the patient breathes in, the diaphragm goes down, it pushes the spleen downward. But mind it, spleen lies slightly obliquely in the left hypochondrium. So it will enlarge in the direction of right iliac fossa via the umbilicus. That is what Hackett's classification of splenomegaly tells us, the grades of splenic enlargement. So once the patient is done with flexed knees, I will turn the face to the opposite side and I will ask him to take deep breaths. काका आपका फेस इस तरफ रखो, मुंह इस तरफ रखो, अब मुंह खोल के लंबे लंबी सांस लेना, ठीक है? सांस लो. So when he is inhaling, at that time I will palpate with the tip of my finger. Since the spleen is going to enlarge like this, if it is enlarged, my tip of the middle finger of the right hand will touch the spleen because it will enlarge diagonally. So with each inspiration, the diaphragm is coming down, spleen is coming further down, and it makes it easier for me to feel the spleen. So we proceed forward with gentle palpation and gentle pressure on the abdomen towards the spleen. Don't try to push it very hard, which makes the patient uncomfortable. See, so if I can just ask the cameraman to change the angle, you can see that the spleen is palpable till here. The spleen is large. The spleen is large. It is around 5 to 8 centimeters from the left costal margin, which puts it into the classification of moderate splenomegaly. If you can come closer, I can just show you. See, this is from here. This is the notch of the spleen. You can easily see on the video that this is the notch of the spleen which is present on the inferior surface, which we can palpate. So he is under investigation. He is a case of splenomegaly which will be diagnosed in few days. So always the rule is gentle palpation, gentle dipping. This is the classical method. Move forward, and if the spleen is enlarged, it will hit the tip of your middle finger, like in this case. This is the spleen, moderate splenomegaly. How do we differentiate whether it's a spleen or kidney? Because kidney will also be lying somewhere here. The difference is, whenever the kidney is enlarged, kidney will be ballotable up and down, but the spleen will move like this, as I have said. You cannot insinuate your fingers between the spleen and the costal margin, because spleen is just attaching or is attached to the costal margin. But had it been a kidney, you could have easily insinuate your fingers downward. You can feel the notch of the spleen, as I said I showed you a few minutes ago. So the splenic notch is a very important landmark which you can easily feel once the spleen is enlarged. So spleen will come down with inspiration diagonally, whereas kidneys are balloted on expiration, because on expiration the abdomen will go down. You can just keep your one hand on the back and one hand on the above, and you can ballot the kidneys like this. So these are few of the important points that can help you distinguish between splenomegaly and ballotted kidney. So But one thing I would like to mention, whenever you are getting spleen, don't forget to palpate the lymph nodes, because lymph nodes can be there in so many conditions, like lymph node with splenomegaly, like Hodgkin's lymphoma, myelofibrosis, and many other leukemias. They can present to you with spleen and palpable lymph nodes. So to make a note at the end, always palpate the spleen in the proper method, and always try to see the lymph nodes if you are getting the spleen palpable. If this had been a alcoholic liver disease patient with a big ascites, in that case we can just use the dipping method. This that I have shown you is the classical method. The dipping method would be to dip it further down with both the hands, so that you are just bypassing the liquid or the fluid that is accumulated inside the abdomen, and your hand, this is the hitting the spleen. This is the dipping method. The other method is hooking method, that you can again use in cases of ascites, where you have to stand on the left side of the patient. Ask the patient to just turn on his right, and then you can just hook the left in hypochondriac region to see for the spleen. This is the hooking method. This is one of the other method which can be used when the patient has ascites. So I hope this lecture proves useful to you, and I request everyone to revise it